Mulago National Referral Hospital currently requires 100 cylinders per day. But however, due to the increased demand of oxygen in the country, sometimes the hospital finds it difficult to meet this demand. The hospital administration at Mulago revealed that the surge in numbers of COVID-19 patients has created the high demand of oxygen, but assured the public that currently the hospital can handle.
The patients that have COVID need much more oxygen than the sick patients who are in a normal ICU, requiring 70 liters of oxygen per minute. And yet, the normal patient in a normal ICU requires between 1 and 10. So one patient in COVID ICU consumes the oxygen that would be required by 10 very sick patients in a normal ICU.
Despite of the weakened assurances, the Ministry of Health is in advance to install a 70-meter cubed plant of oxygen, which they say will be completed within 2 weeks at Mulago Hospital. In 24 hours, the oxygen plant at Mulago Hospital can generate about 2,999,520 liters of oxygen, which in normal circumstances can serve over 900 patients. The hospital has 4 fully functioning oxygen plants, with 2 others being upgraded, as the Prince Administrator explains.
We are installing a new plant of 70 cubic meters to supplement on what we already have, so that the production is high. Somebody asked how much oxygen do you need in a day? We need over 4,000 liters per minute, over 4,000 liters of oxygen per minute. And now, at normal production, we can only produce 2,083. So we are trying to bolster the capacity of the oxygen plant so that we produce more oxygen, but also we are working with the partners to ensure that we have constant flow, constant refill of oxygen cylinders, so that at no point do we have a break. Because
at the moment, the hospital is admitting critically ill patients that demand high levels of oxygen flow. The team from the ICU demonstrated and showcased what happens at the ICU.
Percent oxygen is the maximum this machine can produce. And when it is on, the higher the percentage is, the faster the oxygen goes. Now the challenge with these patients, most of them demand that. That explains why one ended up using 3 or 4 cylinders of this giant size in 24 hours.
The Executive Director of Mulago Hospital demystified allegations that Mulago is full to capacity.
The treatment is entirely free. How do I mention it? 0000. Free. 00000. Except if there was like a drug that the patient needed that was not there, that sometimes the patient may be around to contribute. Kawan block, the whole of B, the whole of C, 5A, 6A, what? How do you tell me that we are full? Who is telling us that? I don't know where those things are coming from.
The medics at the National Referral Hospital call upon Ugandans to adopt preventive measures through observing the standard operating procedures in order to reduce on the numbers of patients seeking for hospitalization. Zahara Abigaba, UBC.